Ever wonder about fatty liver disease and its early warning signs? This is a question that could be more important than you might think. You see, fatty liver disease, also known as hepatic steatosis, is a condition that's more common than you might realize. It's a silent invader, often sneaking into people's lives without any significant fanfare, making it all the more dangerous. This condition involves the buildup of fats in the liver, which is normal to some extent. However, when more than 5 to 10% of the liver's weight is made up of fat, it's considered a fatty liver. This can lead to serious health complications, such as inflammation, liver damage, and even liver failure. One of the most challenging aspects of fatty liver disease is that it often doesn't present any noticeable symptoms in its early stages. It's like an uninvited guest at a party, quietly mingling in the background, unnoticed until it's too late. This is why it's so crucial to undergo routine medical exams and tests. These tests can detect the presence of this stealthy intruder before it causes too much damage. So, how do you know if you have fatty liver disease if there are no noticeable symptoms? Well, that's where the importance of regular health checkups comes into play. Through blood tests, imaging studies, and sometimes even a liver biopsy, healthcare professionals can detect signs of fatty liver disease. It's worth noting that fatty liver disease isn't a death sentence, it's a wake-up call, a call to action. With the right lifestyle changes, it's possible to halt or even reverse the effects of this disease, but the first step is awareness. Now let's delve into the red flag signs of fatty liver disease. Because knowledge, after all, is the first step towards a healthier, happier liver. So, what are some early warning signs of fatty liver disease? Fatty liver disease, also known as hepatic steatosis, can be somewhat of a silent condition in its initial stages. This is because it often doesn't present any noticeable symptoms early on. However, there are some subtle signs that should not be overlooked. One of the first signs that might indicate the onset of fatty liver disease is fatigue. This isn't just your run-of-the-mill tiredness from a long day at work or a poor night's sleep. It's a persistent feeling of exhaustion that doesn't seem to get better with rest. Another early warning sign is abdominal discomfort. This isn't typically acute pain, but rather a general feeling of unease or discomfort in the upper right area of your abdomen, right where your liver resides. Unexplained weight loss can also be a sign of fatty liver disease. If you're losing weight without trying, it could be your body's way of signaling that something isn't quite right. An enlarged liver, known medically as hepatomegaly, is another sign. However, this is not something you'd be able to identify on your own. It's typically discovered during a routine physical exam by your healthcare provider. Elevated liver enzymes might also indicate the presence of fatty liver disease. These enzymes detected through blood tests are usually a sign of inflammation or damage to the cells in your liver. It's important to note that, while these signs may not always be noticeable, they should not be ignored. They're your body's way of waving a red flag, signaling that your liver may be accumulating fat. Understanding these signs can help in early detection and management of fatty liver disease. So, if you're experiencing any of these symptoms, don't hesitate to reach out to your healthcare provider. Remember, the earlier fatty liver disease is detected, the better the chances of managing it effectively. What happens when fatty liver disease progresses? Let's delve into the more advanced stages of this condition, namely non-alcoholic steatohepatitis or NASH, and cirrhosis. Non-alcoholic steatohepatitis is a more serious form of fatty liver disease, where the liver becomes inflamed. This inflammation can lead to scarring and hardening of the liver, a condition known as cirrhosis. Both NASH and cirrhosis represent the more severe stages of fatty liver disease, and their symptoms are a clear indication that immediate medical intervention is necessary. So, what exactly are these symptoms? Well, for starters, persistent abdominal pain is a common sign. This isn't a fleeting discomfort, but a continuous pain that just doesn't go away. This pain is often accompanied by jaundice, a condition that causes the skin and whites of the eyes to turn yellow. This is due to the buildup of a yellow pigment called bilirubin in the blood, a clear sign that the liver is not functioning as it should. Another symptom is ascites, which is the accumulation of fluid in the abdomen, causing it to swell. This can lead to discomfort and shortness of breath. Additionally, patients may also experience easy bruising. This is because the liver is responsible for producing proteins needed for blood clotting. When the liver is damaged, it can't make enough of these proteins, leading to easy bruising. Confusion, weight loss, and fatigue are also common symptoms. Confusion can occur because the liver is unable to remove toxins from the blood, which can affect brain function. Weight loss and fatigue, on the other hand, can be attributed to the body's decreased ability to process nutrients and energy. Now, some symptoms might seem less severe, but they should not be ignored. Itchy skin, for instance, can be a sign of bile buildup in the body due to liver dysfunction. Spider veins, which are small, dilated blood vessels near the surface of the skin, can also be a sign of advanced liver disease. Lastly, gastrointestinal bleeding, which may manifest as bloody or black, tarry stools or vomiting blood, is a severe symptom that requires immediate medical attention. These symptoms are severe and require immediate medical attention. Never underestimate the importance of early detection and intervention when it comes to your health. How important is early intervention in managing fatty liver disease? This is a question that we must all consider seriously. Fatty liver disease, also known as hepatic steatosis, is a condition that may not show noticeable symptoms in its early stages. This means that by the time symptoms become apparent, the disease may have already progressed significantly. This is where the importance of early intervention comes into play. You see, early intervention involves taking proactive steps to identify and manage the condition before it escalates. This is typically done through routine medical exams or tests that can detect the disease even in its silent stages. In the case of fatty liver disease, liver function tests are essential for diagnosis and monitoring. But why is this so crucial? Well, early intervention allows for the implementation of lifestyle changes that can help manage the condition and prevent its progression. These changes can include modifications to diet and exercise routines, and even the reduction of alcohol consumption. The goal here is to reduce the accumulation of fat in the liver, and in doing so, prevent the advancement of the disease to more severe stages such as non-alcoholic steatohepatitis, NASH, and cirrhosis. Moreover, early detection gives healthcare providers the opportunity to closely monitor the patient's condition. This enables them to make necessary adjustments to the treatment plan as needed, ensuring the most effective management of the disease. In essence, early intervention is like a preemptive strike against fatty liver disease. It's about taking control of the situation before it gets out of hand and making the necessary changes to preserve liver health. So, to answer our initial question, early intervention is not just important, it's crucial. It's the difference between managing a condition and being overwhelmed by it. It's the key to preventing the progression of fatty liver disease and preserving the health and function of this vital organ. Early intervention is key in managing fatty liver disease and preventing its progression. So, what have we learned about fatty liver disease and its warning signs? We've discovered that fatty liver disease, or hepatic steatosis, is a condition that can often fly under the radar in its early stages. It doesn't always present immediate, noticeable symptoms, but it can be detected through routine medical exams or tests. The red flags to watch out for include fatigue, abdominal discomfort, unexplained weight loss, and enlarged liver, and elevated liver enzymes. We've also delved into the advanced stages of this disease, such as non-alcoholic steatohepatitis, or NASH, and cirrhosis. These stages can manifest in persistent abdominal pain, jaundice, ascites, easy bruising, confusion, weight loss, fatigue, itchy skin, spider veins, and even gastrointestinal bleeding. Above all, we've underscored the importance of early intervention in managing fatty liver disease. Lifestyle changes can play a significant role in this, with a focus on a balanced diet, regular exercise, and avoiding alcohol and unnecessary medications. Regular liver function tests are also essential for diagnosis and monitoring the condition. It's important to remember that the absence of symptoms doesn't necessarily mean the absence of disease. This is particularly true for conditions such as fatty liver disease, which can progress quietly and unnoticed. That's why it's crucial to stay informed and to take proactive steps towards maintaining good health. We've also highlighted that fatty liver disease is not a death sentence. It's a condition that can be managed and even reversed with early intervention and lifestyle changes. So, if you've been diagnosed with this condition, or if you're at risk, don't lose hope. There are solutions, and there's always help available. In conclusion, the key to dealing with fatty liver disease is awareness. Awareness of the disease, its signs and symptoms, its progression, and the steps that can be taken to manage it effectively. And of course, the need for regular checkups and health screenings cannot be overstated. Remember, your health is your wealth. Stay informed, stay healthy. Don't miss out on this valuable information. Subscribe to our channel for more health tips and wellness advice. Let us know in the comments if you found this video helpful, and stay tuned for more health advices to help you live your best life. Stay healthy and see you in the next video.